Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
What we've seen over the last few years is that everyone, in particular kids, have really been struggling. We saw mental health concerns before COVID, but they've really been exacerbated by the pandemic. So many kids have returned to school with the grief and trauma of losing someone that they really love, and continue to be exposed to anxiety after numerous school shootings. When we overlap that with school, it's a really unfair expectation to place on kids to prioritize learning and have their brains prioritize learning. So when we prioritize the school climate and that it's supportive for both students and teachers, everyone feels socially and emotionally supported, so everyone benefits. Texas has made some really dedicated efforts through investments in T-Chat, but that's really more of a responsive service when a child's already in crisis. And there is a school safety allotment available, but it's available for a wide array of things, including hardening, and really mostly hardening. It's really what schools have used it for so far. So what if we focus on a more upstream approach, ideally before crises occur, by supporting mental health and creating positive school environments?
More bills were filed last legislative session related to LGBTQ plus issues and rights than ever before. And actually, Texas had the most bills that were filed that would have impacted LGBTQ plus rights compared to any other state. Over 30 bills would have restricted access to either services or regarding some type of rights for LGBTQ plus Texans. So what's important to know is that we're kind of coming into this session with all of that history behind us, but the only bill that actually passed last session was restricting transgender youth's access to playing sports. But there were other bills that were filed that we know are going to come back this session. The first is actually regarding what type of medical gender-affirming services can be provided in Texas. We know that there are bills filed that would restrict that access, and that really does impact transgender youth. We also know that there are going to be bills filed that would change the definition of child abuse to include providing gender-affirming care. What's important for people to know is that that bill, as filed last session, was not just medical care. It also included counseling and mental health treatment. So, of course, that's something that our team is going to be watching and talking to offices about. And finally, we know that there are going to be a lot of conversations around how LGBTQ plus issues are taught in schools. We've seen this happen in other states, and with Texas, because we meet every other year, we know that legislators in Texas kind of follow what happens in other states, so we're anticipating that that's going to be a big topic this session.
Suicidal ideation, suicide attempts in youth in Texas, particularly related to the pandemic and that isolation and the stress that a lot of these youth went through. One of the big issues that I'm working on is foster youth suicide. Unfortunately, foster youth have a much higher rate of suicide than the rest of the population. So that's actually one thing we're working on a lot, because we found that DFPS doesn't actually maintain records on suicide attempts or suicide ideation, which we're seeing is just a huge issue. And then in suicide prevention in general, data is just a big issue, because anecdotally we know it's happening, but if you don't have the data or the numbers, you can't really drive change in the legislature. So we're really hoping that we can get some better data on suicide in Texas and use that to drive change.